My name is Matthew Bell, and I am with Alzheimer'sProof.com. Today, I'm going to sketch some of the risk factors for developing Alzheimer's disease. First, the usual caveat, I am not a doctor. I can't give medical advice. None of what I'm about to say is going to be intended to be a diagnosis or a treatment of any kind. This is simply the overflow of things that I have discovered in my own research. My dad, Jim, passed of Alzheimer's disease in May of 2016, and prior to that I had been his caretaker for some time before he went into a nursing home. And so Alzheimer's is in my family. It's actually my grandmother, who also just passed, had Alzheimer's as well. My grandmother on my mom's side, my dad. So I have Alzheimer's disease on both sides of the family, and it then behooves me to at least familiarize myself with some of the risk factors, and that's kind of what this video is an overflow of. So some of the risk factors are going to dovetail, or at least this conversation is going to dovetail with a previous video and content that I did on the hypothetical causes of Alzheimer's disease, and kind of see a little bit more how that is going to fit together as we proceed. But just bear in mind that it's probably well to situate the risk factor conversation in an overall context of a broader discussion of Alzheimer's disease with respect to hypothetical causes. And then both of these two are going to suggest certain treatment trajectories or certain interventions, if you want to call it that. So the first risk factor that I'm going to talk about is going to be age. And again, I'm not a medical researcher, but in the literature that I've read, the single greatest risk factor, biggest one for Alzheimer's disease is age. It's simply the case that as we get older, the risk for Alzheimer's disease increases. It's as simple really as that. There are record cases. I think the case was a guy who was supposedly 26 years old, youngest case on record of somebody having Alzheimer's disease, something like that. But by and large, we're talking about people developing Alzheimer's disease in their 60s, in their 70s, more commonly in their 80s. It's a disease of old age primarily. The second risk factor is genetics, and there is a class of proteins, a class of genes called APOE, abbreviated that way. Apolipoprotein, I think, is what it refers to. There's a number of variants of these, but the one that sort of shows up in the literature repeatedly is the APOE4 variant. So a person who has this variant of this gene is reputed to have a greater risk of Alzheimer's disease. Another factor is going to be family history. Now here, again, I started the video by recounting the story of my dad dying in May of 2016. My grandma just passed. Although she didn't pass from Alzheimer's disease the way my dad did, she was in late middle stage of Alzheimer's disease. And so it is intuitive that Alzheimer's disease runs in my family. It's on both sides. So for a doctor looking at me, my risk of Alzheimer's because of that is going to be greater than somebody who has no anecdote, no story about anybody in their family having Alzheimer's disease. Now at this point, I think it's interesting to mention, when we talk about risk factors, we're in fact talking about, I think the best way of thinking of it is making a bet. What factors would be in place if we were going to bet that a person was going to come down or manifest Alzheimer's disease, however you want to say it. It's not because the cause of Alzheimer's disease is not well understood. We don't know what the actual cause of Alzheimer's disease is. The most that we can say is that there seem to be certain predisposing factors when we're trying to bet as to who has a greater risk of Alzheimer's or not. Clearly, age by itself doesn't do it. There are many people who live to a ripe old age and who never visibly manifest anything like Alzheimer's disease. So age by itself doesn't do it. Presumably genes by themselves don't do it. Family history by itself doesn't do it. There's been other people in my family who haven't had Alzheimer's disease and so on. So the idea is simply, maybe the best way of thinking of these is that we're trying to figure out who has a greater risk And we do that by observing certain things. It's like if you were betting on a horse to win a race, and you might say, well, this is a young horse, good genetics, it's got a history of winning in races, it might be a pretty good bet. But it certainly doesn't guarantee that that horse will win the race. It's just that when those factors are present, you just think, oh, that's a good bet that that horse is a good candidate for winning this race. So it's a similar thing here, not positive like winning a race, but when there's older age in the presence of the gene APOE4 with a family history of Alzheimer's and some of the other things I'm about to sketch, we might say that it's a bet. You might bet that that person has got a higher risk for Alzheimer's disease. So we're sort of talking about a guess about risk here. But that said, a number of these risk factors are going to have to do with health now. So we talked about age, we talked about genes, we talked about family history. One other, before I get into some of the health concerns, is actually going to be sex, meaning male or female. It turns out that females have a higher degree of risk. But it's not clear, this is controversial, it's not clear if it is actually due to something inherent, like say hormones that have to do with being female, or if it just has to do with the fact that females, by and large, have a slightly longer life expectancy. So when you think about it, if women are going to live a little bit longer on average than men, then it stands to reason that if age is a risk factor, because women attain a greater age, they also have a greater risk of developing Alzheimer's disease. So that's another risk factor that you'll encounter. Then there are risk factors that have to do, again, with basic health. So for instance, obesity. Obesity is correlated with Alzheimer's disease, such that a person who's obese has a greater risk of developing Alzheimer's than a person who's not obese. Another one would be physical injury to the brain. And in the video on cause, we talk a little bit about this. I'm going to talk a little bit about this again in another video on some of the alternative treatment approaches and things like this. But people who have jobs like a boxer or MMA fighter or hobbies, not necessarily a job, but people who have had traumatic brain injury, again, raises the risk of Alzheimer's disease. Smoking also raises the risk of Alzheimer's disease. Alcohol is correlated, and I've spoken about this a little bit. Chronic alcoholism is connected to dementias of various kinds, whether it's Alzheimer's or not. Then there are things like other actual conditions or diseases that, when they're present, seem to increase a person's risk of Alzheimer's disease. So one of these would be diabetes, Down syndrome, having high cholesterol, having high blood pressure, having hardening of the arteries, or atherosclerosis, I think is the technical term for it. These conditions also raise the possibility that a person is going to get Alzheimer's disease. Then there are factors that have to do with things like exposure to certain things in the environment. And here, one of the classic ones that I have encountered in the literature is aluminum. So when a person has exposure to aluminum, and this could be in a number of different ways. It could be eating off of dishes that are made of aluminum or various things of this kind, then that also can correlate with a higher risk of Alzheimer's disease. So when we survey the landscape of the risk factors, we notice that some of them have to do with external things, like, for example, exposure to aluminum. That has to do with an external factor. Some things that are not inherent to who we are, for example, traumatic brain injury, that can happen to anybody regardless of their genetics. Then we have things that are basically very much relative to the person's genetics, the person's health history, and the like of that. And those things straightforwardly include the genes, the family history, And then, of course, we have age as a factor. So surveying the entire landscape individually, these risk factors have been written on. And I invite you for further information on these, because I've kind of just really skimmed the surface. I invite you to check out my written work at alzheimersproof.com. I also invite you to view the other videos that I have, including the one that I mentioned earlier on hypothetical causes. But when you think about some of these risk factors, they also suggest certain ways that a person might mitigate his or her risk. So, for instance, we can't do anything about aging, but you can think about things like health history. For example, diabetes. Make sure if a person is diabetic that they have their diet under control. A person who might be overweight might do well to try to shed some of that mass to bring the body mass index down, and so on. Try to avoid activities and things that might result in traumatic brain injury. Don't smoke, don't drink excessively, and things along the lines of that. And I say excessively because in another video we'll talk about a compound called resveratrol, which is supposed to be in especially red wines, and that can have a neuroprotective effect. So there is a sense in which certain alcohols might actually be beneficial in moderate quantities. But in any case, all of this to me is a little more than academic, because as I say, my family history certainly does predispose me. I don't know about genetics. In a further video, I may actually report on something like the 23andMe gene testing that might indicate what my personal genetic risk is, and I'll follow up on that at a later time. But in the meantime, I hope that something that I've said may have sparked a research trajectory for somebody in the audience. I know this is not an easy topic ever, but it is a relevant topic. There are so many people suffering from Alzheimer's disease now, and the figures are that this is going to more than double over the next couple of decades. So I appreciate your time today. Again, I invite you to check out my written work at alzheimersproof.com. If you found something of value in the video, please like and subscribe to the channel, and look for further content, because I intend to have a number of other videos that I've got in the works and in editing and at various stages. So thank you so much.